All right, so I'm gonna be taking you through what's known as a knee car. This is a controlled articular rotation. Key word being controlled. We're not trying to rush through anything like this. We're gonna recommend doing this for about 1 minute to 2 minutes straight of just tempoed practice. And what it involves is just isolating the movement within your knee and trying your hardest to not compensate through your hip or your ankle or shifting your body side to side. So if being on the ground is a little too intense, you can do this on a box or a chair, and you don't have to go through these deep ranges of motion at first, but we're just trying to judge how well we can control the rotational aspect of our knee. And what we'll see here is at the front of the knee, where your patella comes to an insertion site, patellar tendon, right through here, you'll see as I externally rotate or rotate my foot outward, you'll see the tibia wants to rotate out, and then as I rotate in, it starts to shift inward. But I'm not going to try to invert my foot where my foot starts to cramp down and crank down this way. We're going to try to keep it relatively neutral and see what kind of motion we can get out of that. Then we're going to couple that with extension and flexion. So I'm going to hug my leg and try to isolate my hip the best I can. I'm going to start with turning my foot outwards slightly so that the tibia shifts outwards. Then I'm going to slowly start straightening my leg out to the best of my abilities. Things get shaky, things get hard. Then I'm going to rotate in and bring it down and keep rotating in as I come down and hug my hamstring and calf together, and then rotate out and open, 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 straighten the leg, gets hard, turn, and close. Then I can flip it and reverse it. So I can start in, go up, turn out, go down, hug the hamstring to the calf, in, up, and around, turn out, and back down. So we want to be doing that for roughly 1 minute to 2 minutes, and that would be considered a really nice way to warm up our joint to get full ranges of motion that we have access to from the femur to the tibia. And there is that rotational component to it. So this is actually a rather important drill to be doing for the health of your knees.